stopped living as a professional athlete in around 2015 or 2016, and in the 5 or 6 years after, even though I'm training a lot and continuing to learn and grow as a martial artist, my body started to feel the effects of the wear and the tear. Never really had back problems, but it really started to bother me when my daughter was born. And I would go to pick her up and burp her or just hold her or feed her, and there would be areas of my back that would ache, that would really hurt. And then it would start with a medium ache, and then the longer I would hold my daughter, it would become an intense ache and then a really acute pain. And that's when I realized, okay, I have to fix that. It's one thing to not quite be able to train as hard as you want, or not be able to lift as heavy of a thing. That's no big deal, but to not be able to hold your daughter when you want to, that's something that has to be fixed. I'm Robin Black. I analyze martial arts for a living, human movement. I'm deeply curious about how and why people move, particularly combatively when they're fighting each other, unwilling dance partners with conflicting objectives. To do that well, I have to move. To really understand combative fighting, movement, I have to move my body, train all the time, which I love. And I was a professional fighter for 7 years. And when I was fighting, you deal with a lot of injuries. I had problems with my fascia. I had thyroid problems from head trauma and overtraining syndrome. It damaged my eye, shoulder problems, but I never had any back problems, never really at all. When I was fighting, when I was training as a full-time professional athlete. But your back does sustain a lot of damage. And in the years after, my last fight, I believe, was 2014, and I think I was preparing for fights a little later. So, I stopped living as a professional athlete in around 2015 or 2016. And in the 5 or 6 years after, even though I'm training a lot and continuing to learn and grow as a martial artist, my body started to feel the effects of the wear and the tear. I started working with actually Dr. Khan's mentor, Dr. Gallia, when I was fighting, particularly when I developed hypothyroidism. So my thyroid stopped working, and people high up in the fight world were like, you should see Dr. Gallia. And he helped a great deal. My thyroid is zero problem for me now. Even though it's not very functional, it's treated very well. As I was moving from a full-time professional athlete into this stage of my life, with a lot of travel and moving, Dr. Gallia's traveling and I'm traveling, Dr. Gallia referred me to Dr. Khan, who is awesome. And so I've been seeing him for 5 or 6 years. He's monitored my thyroid issues from back in the fighting days, as well as any wear and tear and other problems I've had as I'm in my 50s and I still have to move as part of my job and my passion. So Dr. Khan's been awesome. When we started talking about this, and I realized just how much of a kind of a global expert he is in PRP, he's traveling to the Middle East to work with the highest level sheikhs and princes of places. And he's talking about the different innovations that he's doing, which when you're on the front end of anything, you want to innovate. You want to see how far you can push it. And he was talking about that. And suddenly I was like, how old are you? And he's like, I'm 33. And I'm like, he was like 27 or 28 when I started seeing him. He's brilliant. He's really brilliant. And if you're lucky, whether someone's building your house or analyzing martial arts or whatever, fixing your body, if you're lucky to meet people who are on the very front end of what they do, you should be very grateful. And I'm super grateful.
guys, so you heard the story from Robin Black. So today's procedure is all about treating him and getting him better. And so what we're going to be doing is using ultrasound guidance with platelet-rich plasma injection directly into the muscle tear that we believe is causing his pain. So this is something that's actually often overlooked and often missed with a lot of practitioners who treat chronic back pain or any sort of chronic pain really. A lot of times they just look at the disc or they look at the joints, but they don't look at the actual muscle. And so as a sports medicine doctor, our specialty is musculoskeletal system. And so we've figured out how to diagnose muscle tears better than almost anyone in the world really. And so that's one of our skill sets that are really unique. So with chronic back pain, there's multiple pain generators, and often it's not just about treating one problem. In some cases it can be, but the point is, even with MRI, which is a high quality resolution imaging, sometimes they miss muscle tears. The reason is because they're so focused on the nerve, the disc, and the joints, they don't really look at the muscle itself. And so you need to do what's called a high resolution dynamic ultrasound assessment to really look at the muscle quality and make sure there's no tears or defects in the muscle tissue. What you'll see is pictures of his muscle tear where there's a black area, and that kind of highlights what the muscle tear looks like. And so we're going to use platelet-rich plasma, and we're using a special type of platelet-rich plasma called cyto-rich. And the main difference between this is that you saw him come in the morning for a blood draw, and then we process it for 4 hours. The reason why this is important is because you can change how you process plasma. So what that means is you can just spin it in a centrifuge, but the RPM, the temperature, how long you spin it, and even incubation or cooling, and there's different ways to process it, and that can all change how the plasma works. And so what we discovered is that through our patented process, we can make it more anti-inflammatory. And what that does is it's better for chronic inflammation, chronic tears, and especially chronic nerve pain, chronic back pain. We've used it for lots of those type of problems. And so we're combining our cyto-rich plasma with regular PRP to kind of treat this problem. So it's not just a regular standard plasma that we're using, we're actually using a second generation or new type of plasma. And that's really important for people to understand, is that it's not one size fits all. And that's the thing about a sophisticated plasma injector or regenerative medicine doctor, is that understanding there's different types and knowing how to apply those in different situations. So let's get into it and we'll show you how this works. In this procedure, we're going to be treating his upper and lower back chronic muscle tears. This is something that's often missed actually on MRI, so people don't pick it up. And even if they pick it up, they don't have great solutions for it. They may recommend surgery, and obviously surgery is much more invasive. The beauty of this procedure is it's minimally invasive. It can be done the same day. There's basically no side effects and no real risk. And so it's a great option for people who want to get better without getting cut open. So the rhomboid muscle is a muscle you can think of when you roll your back. That's the muscle that's getting activated. So whenever you do any sort of rowing movements, and it also helps with extension of the back, and it helps to stabilize the spine. And now what can happen is that you can have chronic pain in this area because there's low-grade muscle tears. And these are not picked up by regular imaging, so we picked it up using a high-resolution ultrasound. Similarly, in the lower back, which is something that's much more common, there's something called the multifidus muscle, and that can also lead to low-grade chronic tears and cause chronic pain. And that's also something that's not picked up routinely in MRI. So it is an interesting thing because we can use high-resolution ultrasound to diagnose and treat it at the same time. Now that you understand the anatomy and you understand kind of what's going on, what we're going to do is we're going to repair these chronic muscle tears using platelet-rich plasma. What it does is it sends signals to your body's own stem cells to start the regenerative process. Because if you think about it, the plasma is only going to stay there for a couple of days at most, and so it's going to disappear into the body. But in the meantime, what it'll do is it'll start this cellular regeneration process through the stem cell signaling. And so it'll be cool to see in 6 weeks when we bring it for a follow-up that the tears are healed, and hopefully he'll be feeling better by then too. So I'm just grateful for the opportunity to help Robin get back to living his life without pain and being able to lift his kid and not worry about it.